Hello, I'm Jim Demo with Clark County Close-Up. Thank you for meeting with us.
Thanks for having me.
So, can you please give us some details about the flu season here in Clark County?
Absolutely. So yes, we are in the middle of the flu season in Clark County. Flu activity is still fairly high, but we seem to have passed the peak, at least in terms of numbers seem to be on the downswing. It's still early, so I can't say that with 100% certainty. Last week we had 243 cases reported to us. 2 weeks prior to that, it was 400. So a little bit less.
And we're recording this in mid-January, just so viewers
That's
have
right, yeah. So we also track the percentage of flu tests that are positive. So 3 weeks ago it was 43%, and this last week it was 30%. So a little bit less, but again, it's still early. Also compared to previous flu seasons, similar numbers, but again, we're still kind of early, right in the middle of the season, so it's tough to say for sure. But past seasons were described as moderate, and I think that's kind of what we're looking like right now.
Okay.
Yeah.
So when you're talking about the flu, I think
Yes.
there's some confusion. Does the flu include like stomach flu? What are we talking about here?
That's a great question, and one that I hear often. So no, the flu we are talking about influenza virus, which is different from the stomach flu.
Okay.
The influenza virus is a virus that attacks kind of your whole body, but especially focuses on your respiratory system, so your lungs, your throat, your nose, and those are the things where you have most of the symptoms. So it's spread by people that cough or sneeze, and then other people will breathe in that air, or by touching things that people with the flu touch. And then we see a very distinct season of the flu, so it's usually late fall to kind of early spring. The stomach flu, so I don't like to use that term because of the confusion that happens with it, so I usually just call it like a stomach bug or something like that. And that can be caused by, there's dozens of different viruses and bacteria and parasites that can cause kind of a stomach bug. And then we're looking specifically at vomiting and diarrhea in terms of symptoms. So they're different in that way, yeah.
So what makes influenza so serious?
It's a good question. So in certain populations, and even sometimes in healthy people, it can cause a very severe illness. So that cough and fever can sometimes lead to pneumonia. So especially in people like pregnant women, elderly people, young children, and people with chronic diseases like heart disease, lung disease, diabetes, those people are at higher risk of having those complications. So something that might lead you to the hospital, something that actually might lead to death. So yeah, that's what we're looking for and what we're trying to prevent.
Okay. So what should you do if right now someone's watching at home and someone in their family, either them or someone else in their family, has the flu? What kind of steps should you take?
Yeah, that's a good question. So if you or a family member has the flu, it's important to try to stop the spread of it. So everyone being really good about washing hands, trying to limit contact with the people that are sick. If you're in one of those groups that I talked about, pregnant people, people with heart and lung disease, really young people, it'd be great to call your doctor and ask for advice. There are some treatments for the flu that will kind of decrease the severity and how long the disease lasts. And it's important to start that medicine early on in the illness. So those are some steps I would take. Definitely wash your hands and call your doctor if you get a chance to. Yeah.
And should you avoid, like, if you have a sick child with the flu, keep them home?
Absolutely.
Don't go to work?
Yes, if you know it's the flu, absolutely keep them home, at least until they don't have a fever for about 24 hours. That's kind of the goal. And I would definitely recommend staying home from work if you have the flu. You don't want to spread that to other people. It can be, a lot of people kind of downplay it, but even if you're not hospitalized or have a serious illness with it, I've heard of people, being in bed for 1-2 weeks with the flu, and it can be very miserable.
Okay. So the good news is you can prevent getting the flu. There are ways. What's the best way to prevent getting the flu?
Absolutely. The best way is to get vaccinated. So we recommend every year a flu vaccine for basically anyone over the age of 6 months.
Oh, really?
Yes. And then, some of the things I talked about earlier, hand washing, staying away from people that are sick, those are some other ways to stay healthy as well.
Now, why do you have to get a flu shot every year?
Yeah, that's a good question. So scientists look at this issue, and we have to study the flu virus that's in other places, and it changes every year.
Okay.
So they look at what the flu is looking like in other places, and then they try to predict what it's going to look like here. And then they make the flu vaccine based on those predictions. And most of the time, they're pretty good. It's never perfect, but no matter what, it's always going to decrease your risk of getting the flu if you get the flu vaccine.
Now, how safe are vaccines? And can you get the flu from getting the vaccines? You hear that as well?
I do, and I hear that from my patients a lot. The flu vaccine is very safe. The most common side effect that people have is a little bit of soreness. If you've ever gotten a shot, you will notice that. In younger people, you're more likely to have a low-grade fever, so that can happen as well. Really serious side effects are extremely rare. We're talking maybe 1 in a million, and so rare that it's much more likely that you're going to have an extreme illness from the flu or die from the flu than have one of those, severe side effects, so severe reactions. And you can't get the flu from the flu vaccine. If you think about it, it's very similar to other vaccines and how it works. So people, you will get a tetanus shot if you have a cut or something like that. And people are not so worried about getting the tetanus from the tetanus shot. It's a similar way. So the other thing I would tell people is that sometimes I hear from patients that they get sick after they get the flu shot. So I've heard that a lot. And what we've looked at is that we've looked at groups of people. Some people will get the shot, and some people will get like a placebo shot, so a fake shot, something filled with salt water. And then we compare the two groups, what happened after that. And what we see is that people get the same rates of illness in terms of like cold symptoms after that. So between those two groups, so what I think is going on is we start giving the flu vaccine, late fall. It's right around when those colds start passing around, and I think it's just a coincidence, to be honest. Yeah.
Okay. So can you explain, health experts say a high vaccination rates are necessary to create a herd immunity.
Yeah.
Can you explain what a herd immunity is?
Yeah, that's a great question. So herd immunity is the idea that if most of a group of people are immune to a disease, so either they were vaccinated for it or they had it in the past, we will, that group of people will protect the people that are not immune for whatever reason. Either they didn't get vaccinated or they can't get vaccinated or they didn't have the disease in the past. So what we're trying to do by boosting vaccination rates is increase the chance that we're going to have good herd immunity among a population. So what that means practically is that we will protect people with lower immune systems, so people on cancer treatment or young children or people that are just more likely to get sick or less likely to have a good response to a vaccine, or in some cases are not able to receive a vaccine because they're not old enough.
Okay.
Yeah.
Okay. So you talked about it earlier. How is a cold different than the flu? And are there any vaccines available for a cold?
I wish there were vaccines available for the cold. Unfortunately, we do not have a vaccine available for the common cold. The common cold is kind of a group of symptoms, so often a cough, runny nose, sore throat. People know these, but it's caused by, honestly, there's hundreds of different viruses that cause the common cold. So influenza is one specific virus that we're looking at. It's different also in kind of how severe you get in terms of symptoms. So people will get more sick with influenza usually. For adults especially, it's unlikely to get a fever with a common cold, but you will often get a fever with influenza. The cough usually is a little more severe with influenza. And people get hospitalized with the flu, and that really doesn't happen with the common cold, very rarely. Also, one thing we look out for is, influenza leading to pneumonia. That doesn't happen with the common cold hardly at all either.
Okay.
Yeah.
And the same, without the vaccine, but the same basic precautions, wash your hands, things like that?
Yeah, washing your hands, yeah, so specifically for like the cold and the
Cold,
flu, yeah, absolutely. So washing your hands often, hand sanitizer is good for the common cold as well, preventing. One thing people do without realizing is actually touching their face throughout the day. And actually studies have shown that if you touch your face less, you will get less sick, or you will get sick less often. Another thing I tell people is to stay on top of kind of their preventive things with their doctor, as well as take their daily medications. So for example, something like diabetes can affect your immune system. So if you are controlling your diabetes, you're going to be less likely to get sick. And there is some evidence that regular exercise can help prevent colds and the flu as well. So that's something I recommend for people.
And then, like, if you sneeze or cough into
Oh,
your...
absolutely,
Okay.
yeah. Try to cover, the hands are better than nothing, but generally we recommend sneezing or coughing into your arm or something else. If you do sneeze or cough into your hands, just try to wash your hands right away.
Yeah, because you're touching every doorknob
Exactly,
and
yeah.
everything else.
Mm-hmm.
Okay. So if people want more information about avoiding these kind of respiratory illnesses, where can they check?
Yeah, so they can check Clark County Public Health's website, and there's a link there to the CDC's page. If you go under communicable disease, it'll link to the CDC, and there's lots of information there that's very reliable.
And then we have a phone number, 564-397-8403.
Yes, and that, if you have any questions about the flu vaccine specifically, that's a great number to call.
Okay, well, thank you very much for joining us, and hopefully it'll be a very short, sweet flu season.
I hope so as well. Thank you.